There is a lot of noise out there around supplements, peptides, quick fixes. I want to know what the real hair science says.
Hair is made of 90% protein. So it stands to reason that we need a good protein-dense diet.
What I'm hearing you say is that you cannot out-serum nutrition or stress. Best thing to eat for healthy hair.
First-class proteins.
One supplement that really matters.
Iron.
One thing to stop doing.
Over-bleaching.
One thing to start doing. Hey everyone, it's your friend Lisa, and welcome back to MenoPositive. I am so excited to bring you today's episode because hair is one of these topics I have had the most requests for. Perhaps like me, you've noticed a little less volume, maybe a bit more shedding, or your hair just doesn't feel like it used to. And while it's incredibly common, it is surprisingly unsettling, isn't it? So today, I have brought you the best person to speak to about this. Lisa Bird is a consultant trichologist at Philip Kingsley, who has spent over 2 decades helping women understand and manage hair loss, including her own experience. We're going to talk about the different types of female hair loss, what can be reversed, what needs managing, and most importantly, what you can do about it. We will look at all the treatments, natural, medical, what's hype, what's helpful. And if this is a topic important to you or anyone you know, please, please, please hit the follow button and share this episode with a friend who's navigating hair loss and perimenopause too. Don't worry, I'll give you a second. Go on, you can do it. Thanks so much. It really does make a big difference. Lisa Bird, welcome to MenoPositive.
My pleasure to be here. Thank you so much for inviting me. I'm excited to talk all things hair with you, Lisa.
You have been the first guest where I have really been concerned about what I did with my hair today. Like I properly did a blow dry today because I'm like, oh my gosh, I have somebody coming in from Philip Kingsley. I need nice hair today.
Well, you did a great job. It's looking beautiful.
Do people feel that around you all the time? Do they feel like you're staring at their hair all the time?
That is something quite common, actually. Most people say, oh, I'm sure you're looking at my hair. I didn't wash it today.
And are you also that person that like friends have on speed dial where they're like, okay, what do you think about dry shampoo? I feel that way with my dermatologist.
Absolutely. I'm definitely the hair go-to person in the village where I live, for sure.
the hair person in the village. Okay, Lisa, hair loss is very common, as I have come to learn in preparing for speaking with you today. But that doesn't mean that it is trivial. Can you talk us through a little bit about what are women typically seeing or are they feeling with their hair that they're finally saying, this isn't my hair anymore?
You're right. Hair is not trivial. It plays a really important role in our confidence and many other parts of how we feel psychologically about ourselves. And so those hair changes, there are lots of hair loss conditions that can happen at any time of life, but going through the menopause or perimenopause, there are some specific ones that seem to crop up again and again, largely due to the hormone changes. What I would say is the number one change with the hair is that women can start to feel their hair is more lightweight. So it's often a feeling rather than perhaps seeing something significant. So it might be that they feel the top area of the scalp, so the region kind of where the center parting is, feels more lightweight perhaps in comparison to the sides and the back of the hair. Maybe when they look in a mirror, particularly if there's a light above them, can start to see through the hair and see the scalp a little bit more. So that's one of the most common changes. The second most common change is that women experience an increase in the daily amount of hair fall that they have. So we're used to seeing a few strands fall out when we shampoo or handle our hair. During the menopause, because of hormone fluctuations, we can see an increase in daily hair fall. And if that goes on for a long period of time, that can result in an overall loss of volume to the hair. So not in any particular spot on the head, but overall just a feeling that you don't have the amount of hair that you used to have. And third change would be, I would say, about texture or condition changes. So lots of my clients would say to me, my hair has never felt so dry as to, at this stage of my life. It's not tolerating bleach anymore. I'm having to hold back on the heat because it's brittle or it's more wiry and it just doesn't feel like my usual glossy, silky locks. And that's a big shock to a lot of women.
It feels very common to the overall menopause conversation because women usually tend to say, I just don't feel like myself anymore. So,
Mhm.
what you're saying about hair really relates. So, hair loss in menopause, is it different than other types of hair loss?
You can experience the hair loss conditions that we see frequently in menopause at any time of life. It just seems to be that the menopause is a trigger for these hair loss conditions. And so it's more common to see something like genetic female pattern hair loss occur at the menopause. It's more common at that stage of life than it is younger in life, but it can rear its head younger in younger women as well.
And you touched on this a little bit already, but it is confronting because hair is such a big part of who we are. It's a big part of our
Isn't it?
identity as women, isn't it?
Isn't it? We're like peacocks, aren't we? We that display their beautiful coloured feathers. That is exactly what we do with our hair. It's a secondary sexual characteristic, and we use our hair to attract a mate. So you think about how many times you might touch your hair in a day, how often you would walk past a mirror and touch the hair and flick it back and check it's okay. You would lose count of the amount of times that we might think about our hair, and we wear it in different ways, in different styles, according to different scenarios, different situations. If you were going to a nightclub, you might wear it big and bouncy and gorgeous. If you were in a courtroom, you might sleek your hair back and wear it much more polished and serious. So we really use it to add that final part of identity to an outfit or to a situation we might be in as well.
Yeah, or like a character that we wanna play, like
Exactly.
which part of my personality do I wanna bring out today?
Exactly.
And also confidence. I was with a friend yesterday who had a really emotional weekend, and she was saying, she goes, "Oh god, maybe I'm just gonna get my hair done." Like, it was a way of helping to pick herself up and, help with confidence and her emotional well-being as well.
I totally agree, and I feel that, Philip always used to say he coined the phrase "bad hair day." Mr. Philip Kingsley himself, because what he meant by that was you can have your immaculate makeup on and your best dress, but if you look in the mirror and your hair has gone wrong, it will ruin your day. But the reverse is also true. So you can have your old t-shirt on and your jeans with holes and your dirty sneakers, but if you've just walked out of a salon and your hair is looking $1 million, you feel $1 million.
Absolutely, I can agree with that, and I remember, like, just in terms of it being a big part of your identity, I've had long hair, for a big part of my life, but I don't know, every 8 years or something, I cut it all off and I go short. But the first time I did that, I went into my hairdresser and he just snipped it, and my whole body, like, convulsed. And, like, tears started running down my face because I was
No.
just like, "Oh my god." So I never knew it had such a big, like, I just had this visceral reaction to it. Now I'm
Absolutely.
used to it, I'm prepared for it.
Yes.
But yeah, it's funny that way. So do women come in and see you and just start feeling confused? Because are they like, "I'm doing the exact same thing,
Mhm.
but it's not responding the same?"
Absolutely. And I think there is the general, it's a strange thing, isn't it? It's the acceptance that we know as we age and as we go through the menopause, things are going to change with our body. We know that our skin is going to age, and we know that we might get some, stiffness in the joints and the body might change. We might have some weight gain. But actually, what I find is a lot of my clients found it really hard to come to terms and accept that their hair is changing as well. Lots of my clients would show me photographs and say, "But Lisa, this is what my hair used to look like. It used to look like this, and it doesn't anymore." And I find it's quite strange, isn't it, that we accept and know that the skin will change, but we really can't let go of the fact that we really want the hair to stay the same.
Well, in preparing for this, I mean, maybe it was silly, but you talk about the scalp as an extension of the
That's
face.
right. Yes. Yeah.
I never even thought about it, probably because
No.
it's covered in hair.
Exactly, that's true. So we just forget about it, we neglect it, and we don't really think about scalp care, perhaps until we have a problem with the scalp or we have a hair loss issue. And then it comes to the front of mind because, your scalp is the bedrock of hair growth. It's a living environment, and every hair follicle is embedded in the skin of the scalp. Every single hair follicle has its own blood supply. All the hair follicles are independent of each other. That's why one hair can fall out and the one next to it will stay in, and we wonder why. But it's the scalp is the home of hair, the hair and the hair follicle. And so how we treat our scalp, or if we neglect our scalp, that's going to show up in the hair as well.
And I think you're right. I mean, this is really common. People, unless they're experiencing hair loss, they don't really think about it that much. It's common for many, many things. But what I love, the reason we're menopositive is because we are all about a positive, proactive approach. So we're finding more women, younger and younger, are coming to our events and are listening to the show even because they want to know how to prepare their bodies for a
Yes.
smoother menopause experience. And I think there are things that we're going to talk about today about how to look after your hair. You don't have to
Yes.
wait until something bad is
No,
happening.
we don't wait until all our teeth have fallen out before we go to the dentist, do we? So
Yes. Yes.
it's
Good
good
point.
practice.
Good point. And the other reason I loved having you on the show is because for everybody listening, Lisa, this is very common. And you also say this is very manageable.
Absolutely.
There is hope for us.
There is absolutely hope. I am living proof. We'll get to that, I know. But absolutely, it's a time when we do have to take some early intervention. So don't ignore signs of hair changes. But I have never had a client in the clinic, a female client in the clinic who's gone bald, but that is one of the most commonly asked questions when I would see a client with hair loss. They'd say, am I going to go bald? Am I going to lose all my hair? It's very, very rare. There's always something we can do.
This is what I like to hear. Okay. So we've talked about this a little bit, but let's get on to what's driving the change. Walk us through what's happening to our hair as hormones start to shift.
So hair loves estrogen.
Don't we all? Yeah, all parts of our body.
Many parts of the body love estrogen. Estrogen actually it's very protective of the hair follicle. So it helps the hair to stay in its growth phase for its maximum amount of time. So you imagine during pregnancy, estrogen rises. Most pregnant women find their hair gets better and it's fuller and it's more lustrous and it's not falling out. And that's because they've got estrogen in abundance. And that changes when baby's born. But that's a classic example of how hair loves estrogen. So it's protective of the hair follicle. As we go through the menopause and estrogen starts to diminish, we lose some of that follicle protection. So the follicles are on their own. They don't have that, they're not being taken care of by the estrogen levels. And what can happen with some of the hair follicles in some area of the scalp in some women. So I will say that it's not every woman and it's not the entire scalp. Some of those hair follicles without the protection of estrogen will start to what we call miniaturize. So the follicle, which is the opening in the skin that grows the hair, actually starts to miniaturize in the absence of estrogen. And it's a gradual condition, kind of takes years to happen. As the follicle miniaturizes, the hairs that grow from those follicles get finer and finer and finer. That's why the hair becomes more lightweight. And over those successive hair cycles, the hairs get shorter and shorter and shorter until eventually growth will cease in those hair follicles. So, but it's not noticeable. We've lost about 15% of our hair before we even notice it. So it's a gradual change. So the follicles are getting smaller and it's usually in the top area of the scalp if it's a genetic hair loss condition that's triggered at menopause. Follicles smaller, hairs are finer, hair becomes more lightweight.
And sorry to interrupt you, but when can this happen? Like I guess it's different for each woman, especially their perimenopause journey is different for everybody. But this isn't something that's just like, after your cycle ends.
No.
This can happen through the perimenopause period as well.
Absolutely, because your hormones are fluctuating at first and then you're seeing that drop in estrogen. And it's dependent on, I will say it's dependent on the gene you've inherited. So not every woman has inherited a gene for hair thinning. I inherited the gene. My dad was bald. So I inherited the gene from my father and it's the menopause that kicked it off, that triggered it. So for me, it was quite a dominant gene in the family. It started for me when I noticed the hair thinning really around the time of perimenopause, about 47. So it kicked in quite soon for me. But for women who don't have a dominant gene in the family, and their estrogen isn't dropping quite so quickly, it might be much further into their menopause journey that they see some changes.
And I guess you wouldn't even notice it right away. Like there may be, because the hormones are fluctuating during perimenopause, you might have a few months where your hair is like, ugh, and then all of a sudden it picks up again and then it goes
Absolutely.
down. So that it can be really confusing.
Exactly. And the other change that we see is excessive amounts of hair shedding. So some women will report that when they are shampooing or handling their hair, they're seeing too much hair come out, an abnormal amount. And that can be because of the fluctuating hormones and the surges of hormones that create or can cause, real hot flushes and hot sweats in women. All of those hormones surging can interrupt the hair growth cycle. So for that reason, you might see periods of excessive amounts of hair shedding, and then it will settle, and then you might go through it again.
You have been mentioning the word hair growth cycle. Okay, talk
Yes.
us through the hair growth cycle.
Yes. It's strange, isn't it? Because I know that some people might think that this head of hair we have now is the same head of hair that we had 6, 7 years ago, 10 years ago, and we just keep cutting the ends off. It's a completely different head of hair. So the hair cycle has 3 distinct phases. So it has a growth phase called an anagen phase, and that growth phase can be anything from, say, 2 to 7 years. What that means is about 90% of the hairs on the scalp at any one time are actively growing. And they're the hairs that when you pull them, they hurt. They're in their growth phase. Don't pull them. So 90% of the hairs are growing. And for example, your hair growth phase might be, I don't know, 5 years. It depends how long you could get your hair. My growth phase is quite short, so it's closer to the 2 years because I can't grow my hair very long. So hair goes through its natural growth phase, and the growth phase is predetermined. It's genetically predetermined. You see some women who can grow their hair to, their knees. That's not common, in the Western world. So the growth phase goes on for a number of years, and when those hairs have finished their natural growth phase, they would then move into a transitional phase called a catagen phase. That just means that the hair is moving away from the blood supply, and it takes about a week. Once the hair has left its blood supply, it sits in the hair follicle. So then it moves into its telogen phase, which is its resting phase. So the hair is in its hair follicle, it's not having any more cell division, it's not having any blood supply. Sitting there, the hair follicle needs a rest after 5, 6, 7 years of constantly changing. It rests for about 3 months, and then that hair will drop out and a new hair will come right behind it. So every hair on the scalp is being renewed, and you've probably got a full new head of hair in, on average, 5 years, let's say.
Every 5 years, you have a new head of hair.
Roughly. For me, it would be sooner because I've got a short growth phase.
Yeah.
For you, it might be longer if you
Oh
can.
my God. Yeah, because you're right. You just think that it's just growing out and
Yes. Yeah.
you're cutting off the ends. That's crazy. Now, what are the 3 most common changes that women see in their hair as they're going through this shift?
I would say visible changes to the density of the hair, particularly in the top region of the scalp.
Mhm.
So what some women would report is, and what we would see regularly is, particularly if they wear a middle parting, the parting can start to get wider.
Right. And this is where you said if you're standing under a light, it gets
Exactly.
okay.
That's what women say to me. I was looking in the bathroom mirror, Lisa, with a mirror, with a light above me, and I can start to see through. So the scalp becomes more visible. The parting might seem wider. In postmenopausal women, often you get higher temples, so the temple area can start to recede and get thinner. But generally, we retain the front hairline. It's just that we get thinner through the top region of the scalp. And typically, the sides and the back tend to still feel okay. The second hair change, I'd say, would be this excessive amount of hair shedding when we're shampooing and see too much hair going down the sink. And the third one would be the condition changes. So you might find that where your hair used to tolerate bleach, okay, and heated styling tools, no longer. The strands become finer and more fragile and less tolerant of chemicals and heat.
Right. Okay. Okay. Now, and the difference, is there a difference between, there must be the shedding and the thinning?
Yes, absolutely. And they're very easily misunderstood. But the thing is, they can coexist together. So
Yeah,
you can
because
have
I
both.
think if it's coming out, I just think my hair's thinning because my hair's coming out.
Right.
But you're saying too that has to do with the hair follicle maybe
Yes.
getting
So
smaller?
that's right. So what
Okay.
what we as trichologists call hair thinning is a genetic hair loss condition. female pattern hair loss, where the hair thins in a specific region of the scalp. With female pattern hair loss, you actually don't see an excessive amount of hair fall because it's actually a very gradual hair loss condition that secretly goes on over a number of years, actually. So you don't see an excessive amount of hair fall. The hair shedding is when you do see an excessive amount of hair fall. And that comes from all over the scalp. There's not one particular area where you look and think it's thinner here than somewhere else. It's an overall reduction in hair volume. So maybe you tie your hair in a ponytail and you've noticed you can wrap the band around another time compared to how you used to.
Your ponytail gets thinner.
The ponytail gets thinner, that's right. So you can, both conditions can coexist. You can be unfortunate to have both, but they are separate hair loss conditions.
We've been talking a lot about hormones here, but sometimes I think hormones get blamed for a lot.
They do.
And it's not always hormones. And this is why I wanted to speak to somebody from Philip Kingsley as well, because you have a holistic approach to managing this. And it's not just about managing the hair loss. It's about, healthy body, healthy hair. And that's why I think, like I said, hormones kind of get blamed for a lot. But what do you think are the biggest, outside of hormones, what do you think are the biggest drivers? Because I think women are in this sandwich generation as well, and we're blaming the hormones, but there's a lot of other things that are going on.
Absolutely. So nutrition is one big factor. And I think we can't ignore lifestyle and stress levels. And I also think, and particularly speaking from experience, during the perimenopause and menopause, when I found it quite a confusing time before I started on HRT, anxiety started to creep in. And I felt that stress was quite a big factor. And I don't think you can underestimate the impact that stress has on the hair. We know it impacts the body. For someone who's becoming very stressed, you might have migraines, you might have stomach cramps, you might break out in a rash. Why should the hair be immune to what's happening with the body with stress? But nutrition is something that's really important. It is at all times of life if we're concerned about hair. But I do think when you're younger, you can get away with a lot, really, can't you? Whether it's what you're putting on your hair, how you're treating it, the diet can be a bit awful. But I just think it all matters much more as we are going through the aging process. And actually, from a nutritional perspective, we're not as able to absorb all of the nutrients from our food. That changes as we get older. So where we used to eat a particular diet with a certain amount of protein and that was sufficient, that we need to up our game a little bit more. So one of the most important food groups as we age is protein. And we know, there's a lot of talk about protein and it's good for muscle tissue and all of those things. Hair is made of 90% protein. So it stands to reason that we need a good protein-dense diet to shore up the resilience of the hair, the structure of the hair, the condition of the hair. It's all down to, it's not all down to protein, but it's largely down to protein. So that's a really important food group to include in your diet. We should be having protein with every meal, particularly if we have some hair worries.
Oh my God, that is another reason to eat protein, everybody. I mean, because there's been a lot of eat protein, but not a lot of why you should eat protein.
Exactly.
Okay, hair is another good reason for this.
That's true. And also, it's important to still eat your carbohydrates. And I know it's a balancing act, isn't it? Because as we're going through the menopause, a lot of women find they have some weight gain and then start to restrict calories and may feel they need to go carb free for a while. Those things are not good for hair. So it is a balancing act. And I would say if you're worried about hair, I wouldn't start on any restrictive diets because they can impact the hair. So skipping meals or removing a food group from your diet or going for long periods without something to eat, we really need to make sure that the hair follicles have enough energy to sustain growth. The body knows that the hair is not it's not a tissue that we need. It's not important. So it's actually at the back of the queue when it comes to nutrition. All the other organs get seen to first with the nutrition that's coming in, and hair is at the end of the list. So if there's nothing left over, hair just gets forgotten about. So it's a really good barometer of your diet and your general health.
Okay, so nutrition, stress. I mean, I think are GLP-1s having an impact on people's hair?
It's not the GLP-1s themselves, it's the weight loss. So it's the fact that the body has almost gone into shock because it can be a rapid amount of weight loss. It can be a substantial amount of weight loss. And the hair doesn't like those changes very much. The hair follicles will almost go into starvation mode and think, oh my goodness, we are not getting enough calories here. How do we reserve some energy? So the hair follicles will actually, some of those hair follicles that are currently in their growth phase will actually move prematurely into a resting phase to reserve energy. But remember, once those hairs have rested for 3 months, they're going to fall out. So what we see is what we call a reflective hair loss condition with people who are taking the injections for weight loss. So they don't see the hair loss immediately. A few months down the line, the hair has it's shown up in the hair and it started to respond to them.
Oh my gosh, it's just making me think about muscle loss, like, everything, like you were saying, eat protein for muscle,
Sure,
eat protein for hair. The same thing's happening with GLP-1s. They're losing a lot of muscle, they notice it kind of after the fact. That's
that's
something
right.
else to watch out for. And what about medications and things? Like, if you've been you were saying you just had an operation
Yes.
recently. So, I mean, I'm sure there's the stress of an operation, but is there anesthetic or, like, any medications that people are taking on a regular basis that can impact that?
There can be. I mean, there's a whole host of medications that can affect the hair. So, and I won't pick out any in particular, but I think it's just important to notice. There are so many medications that people take really regularly, like statins or antidepressants or anything like that. Things for blood pressure. There are some. If you look at the list, and it's important to look at the list of potential side effects. That will say that alopecia is a known side effect of this drug. And if you feel that you have unexplained hair loss and you are taking a medication, I think it's important to do some research into the medication that you're on. And if possible, to speak to your doctor and say, is there an alternative to this that I could take that perhaps wouldn't have an impact on my hair?
Yeah. But basically what I'm hearing you say is that you cannot out serum nutrition or stress.
You absolutely can't. And I'm really glad that you picked out that, trichology is a holistic approach to hair care because yes, we do care as trichologists what products and ingredients you are using cosmetically on your hair, but actually it's a whole big picture of the health of the individual themselves from their medication they're taking, about their lifestyle, about their stress levels, about their diet. There's a whole host of other things. So it's good to zoom out and have a look at the big picture, really.
Is A lot of the conversations I have with medical experts on the show is the challenges with behavior change.
Hmm.
So when you have women come in and you speak to them about their diet or their stress or those things that they need to change, like before they pick up any hair treatment,
Yes.
to ask themselves, how am I eating or what's going on in my life? Do you find that's a really difficult one for women that come into the clinic in terms of changing how they eat or changing their
Yes.
lifestyle? It's so hard.
It really is because, habits are really ingrained over time and there can be a lot of resistance to make some changes, whether it be about the diet, because I have had clients who are in denial about their diet and they want to maintain, their weight and would say, Lisa, it's not my diet. Surely there's a lotion I can put on my scalp. And I'm
Yeah.
really, really
Yeah.
resistant to change the diet. And also hair care practices. So, a lot of my clients love full head bleach and they say, don't tell me I can't bleach my hair anymore.
Right. Yeah.
I would do anything, but I need to keep the bleach. So I think there is an expectation that we can wave a magic wand and give them something that means that they don't have to put any work in. But really it's, there's and sometimes it's lots of small changes we do that make the biggest difference.
And you probably just take them one step at a time,
Absolutely.
one
Yes,
step at a
yeah.
time. If you're enjoying this conversation right now is the time to hit the follow button or maybe save because I think we're all going to have to listen back to this episode again and take some notes. We will be right back. Lisa, I want to get to the good stuff now. But before we do, I think you have experienced hair loss yourself. What did that teach you? Well, maybe tell us about that experience. And then what did that teach you about, how women feel about their hair?
So I've experienced hair loss on a number of occasions. So I feel the first time I noticed it was in my 30s. And I would just look in the mirror and think, gosh, the ends of my hair are so wispy. I didn't notice anything significant, not a huge amount of hair fall, but just over the years I would look and, my ponytail was really skinny and I could see through the hair. And I wasn't a trichologist back then. I didn't know the things to look out for, but I did have some blood tests with my doctor and he picked up some nutritional deficiencies. So low ferritin, which is stored iron in the body. That's really vital for sustaining hair growth, and low vitamin B12 as well. So those things were corrected. I didn't panic too much at that time of life because I'd always had fine hair and I just thought, oh, it's just one of those things. Then again, I had it in my mid to late 40s when I became perimenopausal. I was a qualified trichologist at that point. And I think that's the stage when a lot of women would panic, but I didn't because I knew what was going on. I knew the mechanisms. I knew why the hair loss was happening. I knew I had access to treatments and I knew I could stabilize the hair loss. So although it was deeply unsettling, and it's at a time when there's so many other things changing in the body and you think, oh, not the hair as well. Please, not the hair as well. I think for me, I was in that fortunate position because I knew the detail and I had access to the information. And then again, much more recently, with two major surgeries following anaesthetic on both and significant amounts of blood loss. It was the blood loss that has taken me into becoming anemic. And so anemia has driven some hair loss at this stage of my life following the surgery. So the trauma of the surgery, the anaesthetic, and the anemia have all played a part in the current hair loss. And again, I feel okay about it now. I know my hair's changed, but I also know it's a temporary hair loss condition and the hair will recover. But yes, there are definitely times in a woman's life when I would see clients and it's all they could think about when they're experiencing hair loss. It's all they can think about every time they pass a mirror, every time they see themselves, would just obsess about the hair loss. And that's totally understandable because it's such an intrinsic part of us, isn't it? And, it's our comfort blanket. For some women, it's their crowning glory. Their hair is everything about them. People would even recognize them by their hair and say, oh, it's the lady with the blonde hair, it's the lady with the long hair, it's the lady with the gorgeous hair. Sometimes we identify ourselves by our hair and it's really important. So for me, there were emotional times, but that the logic came in and I was able to deal with it from that perspective.
Well, your hair looks great.
Well, thank you.
But like you said, I think when people understand what's going on, then they can do something about it.
Absolutely. Yes. Yeah.
So there is a lot of noise out there around supplements, peptides, quick fixes. I want to know what the real hair science says. So before we even talk treatments, though, what are the non-negotiables for healthy hair?
Scalp health, really important. Shampooing frequently, which I know goes against the grain of what lots of people might think. But, a clean and healthy scalp equals an optimum head of hair. So our hair growth and hair quality really relies on how healthy and clean our scalp is, what that environment is like. So if we shampoo frequently, we're giving our hair the best chance. Non-negotiable. Let's not leave it for a week before we're shampooing our hair because the hair will suffer.
And is that a weekly, not weekly, is that like twice a week? Is it like what's frequent?
Daily.
Daily shampooing.
Yes. It's not for everyone.
Yeah.
It is for me because I have fine textured hair and my hair is not acceptable on day 2. For someone with longer or thicker hair, they would say, well, actually, my hair doesn't look like it needs washing on the next day. And the whole styling effort is just too much. So they're not going to do it every day, maybe every other day. Or I would say I wouldn't go beyond day 3 if you can help it. Now, if you've got afro textured hair, very thick curly hair, there are going to be exceptions for sure. But I would say on the whole, if you want to shampoo and your hair looks and feels better when it's been shampooed, don't shy away from it.
Right.
Absolutely. You have permission to go ahead.
It's good for you. And that massage, that scalp massage is really good, isn't it?
Exfoliating the scalp. And, the hair always feels fresher when it's been freshly washed. So if you really want to do it, absolutely go ahead.
But now we also understand it's going to help keep that hair follicle healthy
and reduce inflammation on the scalp as well. If we let buildup happen, so if there's dead skin cells, if there's sweat, if there is bacteria, if there's oil, if there's odors, if there's pollution, all of those things accumulate on the scalp.
Dry shampoo. Build up.
If we just leave that there, we will start to cause inflammation in the skin of the scalp. And we know that inflammation in the hair follicle is detrimental to hair growth and can, in some cases, if you develop an awful scalp, so an extreme scalp condition, it can lead to hair loss as well. So scalp health is really important.
But I'm also glad you called out textured hair or people with really curly hair. My
Yes.
sister-in-law has the most beautiful but
Wow.
really curly hair, and it's always an exercise, I think, for her. Like, she's like, "I'm gonna
Sure.
shampoo my hair today."
It's a
Like, it's
day.
a moment, yeah. But that's something where, yeah, exactly, there are exceptions to some of this.
For sure, for sure. So it's not a rule for everybody, but for the most part, if you want to shampoo, then we can go ahead.
And you touched on iron and B12, those kind of nutrients, those kind of
Yes.
supplements. Is that something people should I think in women, iron can sometimes be really low anyway. It would be worth getting that checked.
Certainly before menopause. So while you're menstruating, it's very common for women to have, on average, lower iron levels. Because you're losing iron every month, and unless you're really good at replacing it, the iron can just dip. Once you're menopausal and you have not had a period for a year, then what you start to see is iron levels generally just normally start to creep up. And so iron deficiency isn't so common in menopausal women. It's more common if you're perimenopausal or premenopausal. But iron is probably the number one cause of excessive hair shedding in women, the number one cause. Iron is essential for sustaining hair growth. And if iron levels are too low, the hairs just keep going through that cycle much more quickly. So we're shedding too much hair. So iron for sure. The typical nutritional things that we would blood test for in clinic. So everybody that would come to our clinic that would complain of hair loss, there are 5 or 6 routine blood tests we would carry out for every type of hair loss. Those are going to be your iron levels, your ferritin levels. So your ferritin is your stored iron, vitamin B12, vitamin D, serum folate, and zinc. They would be the ones that I would always blood test for. And it is surprising how many of those blood tests will come back and we go, oh, do you know, there's some of these, you don't even have to have a deficiency for it to affect your hair. Your levels just have to be on the low side. So your doctor may say, oh, your blood test results have come back fine. You're not clinically deficient in anything. But if you know what to look for and you know those levels are at the low end of the scale, we know it can be impacting the hair.
Yeah, I mean, that's just like, I mean, that advice even is worth $1,000,000 right there because I don't think women think about that
No,
as part of it
absolutely.
either. Okay, so we know iron, protein, you've talked about scalp health, we've already talked about nutrition and stress management, hormone management. Are there any major mistakes though that people are there things that women are coming in and doing and you're like, "Oh my god, please stop doing that right now."
Um, the first one is ignoring the hair loss. I think, we
Okay, just pretending it's not
just
happening?
pretend it's
Okay.
or a lot of women might think, I'm just going to ride it out for a while and let's just see what happens. And those months can turn into years, and they have ignored it and just hoped and fingers crossed that it would correct itself. And with female pattern hair loss, genetic hair loss, it's a progressive condition. So the longer we leave it, the less chance we have of retaining the most hair possible. So the worst thing we can do is just let it go under the radar and ignore it.
The other tip I loved when I was preparing was coloring your hair actually can like continue to color your hair. It can be
Yes.
helpful. Can really
Yep.
help with plumping up the hair. Is that
That's
right?
right. Yeah,
Yeah.
absolutely. So when you color your hair, whether it's with a hair dye or whether it's with bleach, it actually, because it lifts the hair cuticle, which is the outer kind of wrapping of the hair strand, it gently swells the hair. So it makes it feel thicker. I don't know if you have ever found, it certainly happens to me, when my color treated hair, when my roots grow through and the color's ready to be done, the roots get very flat and it's hard to get some volume at the root area. Once that color's been refreshed, the roots will lift up because it's swelling the hair shaft. So there's no reason really not to color your hair or to think you have to stop coloring your hair during the menopause. Even if you have hair loss, a lot of my clients say to me, oh, Lisa, you're going to tell me I can't bleach my hair anymore. I've got to stop my hair color. And I say, no, actually, it's good for your confidence and it's not going to impact the hair. It's not going to make the hair loss worse. Go ahead and do it.
And it's okay if your hair is dry as well?
I think it's important to look after the condition of the hair. So there are definitely things you can do, and reducing heat, styling, using a heat protector, using a weekly hair mask. So I think if we're doing as much as we can to combat the dryness, we can still get away with colouring the hair, as long as the colouring shouldn't be too frequently, and try not to overlap the colour too much, because that's where the dryness creeps in.
The other top tip I loved was about conditioning,
Mhm.
that you condition. I mean, I think this is normal anyway, but from mid hair to ends, don't condition at the top because that also weighs down
It
the
can,
hair.
yes. So always try and remember that shampoo, it sounds like it's obvious, doesn't it? But shampoo is for your scalp, your conditioner is for your hair. So we
Oh,
shampoo.
let's say that again.
Shampoo is for the scalp. So we cleanse the scalp, but we condition the hair. So we actually don't need to waste shampoo. Let's not put shampoo through the lengths of the hair. We just want to massage it into the scalp. The lengths of the hair will get cleansed as those bubbles will travel down in the shower. Those bubbles will pick up any dirt in the hair. The conditioner is just really for the hair, for the mid lengths and the ends. If we put conditioner too near the roots, which is already softer hair and it's not damaged, it's been through less trauma, then it will just add to weight to the hair.
Okay, I am loving these top tips. Okay, I'm going to hit you with a few more. You
Go.
ready? All right, hair supplements.
Aha,
Hype
big.
or help?
Both. Help if your hair loss is due to nutritional insufficiencies. So if you have blood tests done and you think, my iron levels are low, my B12 is low, my folates are low, supplementing those along with a healthy diet and putting those things into your diet as well can absolutely help your hair. Getting those levels back to a good place can absolutely help to improve the hair. If your nutritional status is great after blood tests and you are still suffering hair loss, the hair loss is nothing to do with nutritional status. So actually taking supplements is really a waste of money.
So it's a really good idea to see somebody like an expert like yourself to really determine what's driving your hair loss.
100%. I think you're better to spend your hard-earned money on a blood test than on a pack of supplements, and you have no idea whether they're targeting your particular kind of hair loss.
Yeah, I think the same thing about skin. The dermatologist, Alexis Granite, we've had on the show, and she says the exact same thing. And I mean, there's so many things like to get diagnosed for exactly what your
Sure.
issue is, and then you can treat that.
100%.
Because there's so many people taking supplements and they're going, it's not working.
Absolutely. And it's probably because they don't have nutritional deficiencies. So we're targeting the wrong thing. Diagnosis is key. So blood tests are really good. But if you can have a diagnosis of your particular hair loss condition, and then we fix that problem with the appropriate treatment.
What about hair follicle stimulants? Like there's a product, is it Minoxidil?
Yes.
What about things like that?
Effective. One of the most effective hair loss treatments on the market. Licensed, that means it's safe and it's effective. It's not for everybody. Some people are intolerant of minoxidil because it can be irritating on some people's scalp. Some people don't respond to it, but a high percentage of people, men and women, will see a stabilization of hair thinning, so the genetic hair loss condition. And a lot of people will see some improvement in the hair growth as well. So I'm all for minoxidil. I think it's a good treatment.
And can you get that from your GP? Do you have to get that from a trichologist?
It won't be available on the NHS, so your GP won't be able to prescribe it. A private GP would. You can buy minoxidil in a form from a pharmacy, but it generally has to be sold through a pharmacy. The difficulty with it is if you don't get your minoxidil from a professional, is that there's nobody monitoring you, there's nobody holding your hand, there's nobody checking, is this helping and improving? So you can buy minoxidil from a pharmacy, but I think it's better to buy it from your dermatologist or go through a trichologist. As a trichologist myself, we use minoxidil in our clinic, but we also add in additional ingredients which actually make that treatment so much more effective. So if you can go through a professional who will hold your hand on your journey, monitor your hair, check it's working for you, and keep you safe with it, then I think that's the better route.
Is minoxidil, though, one of those things that if you stop using it, then you're just going to go back to the same? Like, do you have to be on it for the rest of your life?
If you see results, and most people do, and you want to retain those results, you do have to keep on taking it or using it, because you can take minoxidil orally as well. So if you want to keep seeing the results, yes, you continue it. What will happen if you stop taking minoxidil or stop using it is your hair will just gradually go back to the way it was. There are lots of myths out there and misconceptions about minoxidil. people fearing that they're going to lose all of their hair if they stop using it or they're tied to it for life. You're not. If you get bored of using it one day and you think, I don't want to put this on my scalp anymore, your hair will just go back to the way it was when you started using it.
Okay, but we have a thumbs up on
We
minoxidil.
do.
Um, we've talked a lot about scalp already, but what should we be doing when it comes to scalp care? Like what really works?
What really works is definitely frequent shampooing, not ignoring scalp conditions. Maybe use a weekly exfoliating scalp mask just to keep your scalp in check and good balance of the scalp. I'm not a huge fan of using things like derma rollers on the scalp. Yes, they can be useful if you're using something like minoxidil because they can help the penetration of the solution slightly. But I think just derma rollering the scalp basically can just cause abrasions on the scalp, and there's nothing really, there's not too much helpful coming from it. So it's just about maintaining good scalp health, shampooing frequently, and occasional exfoliating scalp treatment, and just not ignoring any signs of flaking or irritation on the scalp.
But you don't need real like a lot of it's not like your skin where it's like buy this serum and then put this lotion on it. And then, like you said, maybe once a week an exfoliator like you would on
True.
your skin, on your face.
Exactly. Less is more sometimes, I think, when it comes to scalp. We're not, we use all of those treatments on our face because we're looking at it all the time and we want to keep it looking young. We don't really need to do quite so much for the scalp. Just cleanliness is key, really.
Yeah, just that good massage, that good little what
Nice.
about those hair scrubber thingies?
I'm not a huge fan. Your
Okay.
fingertips are perfectly adequate. That's all we need.
That's great.
Yeah.
That saves me a little bit. That's fine. Okay, I'm really fascinated in the conversation that's being had around peptides.
Right.
Can you biohack your hair?
I think and there's so much exciting research going on at the minute. It's great, but I think we as trichologists are holding back a bit on things like peptides because the research isn't really there. It's early, and it is more leaning towards reducing inflammation on the scalp and keeping the scalp in good health rather than promoting hair growth. Reducing inflammation on the scalp is a good thing. If you have genetic hair loss, there can be an element of inflammation in the hair follicle. So yes, it's a good thing to reduce that inflammation. But I think the research, I think it's early. And so far, the studies on peptides are much weaker than using something like minoxidil as a proven treatment.
Yeah, it is very early stage science and there is some mixed evidence right now.
Yes.
But I didn't even know that there was a topical peptide. And obviously everybody knows about the injections, but I didn't know there was a topical version of it as well. But just everybody watch out because also where
Yeah.
you source those peptides from
Absolutely.
is
Yes,
something
it's
to
gonna
watch
be
out for.
important.
Hormone treatment. So what about hormone replacement therapy? Can that help?
Well, HRT is useful for women, helps with lots of signs and symptoms, and it can support the hair. It is not a panacea for helping you to grow your hair back. Lots of my clients say to me, so Lisa, if my hair loss is due to menopause and my low estrogen, surely increasing my estrogen, my hair's going to come back, right? Not completely. It can, I would say it's a part of a regime to help with the hair. So it can definitely support the hair follicles, but it's not the only kind of treatment that you would go for to keep the hair good.
I know. I think HRT is getting, the PR it deserves now, the
Sure.
good PR it deserves, but it doesn't fix everything.
Doesn't fix everything.
Does it?
Certainly hasn't in my experience. So it's fixed some of the things that I needed fixing, but
Yeah.
not everything, sadly.
No, absolutely. And what can hair thinning during menopause be reversed, or is it something like what can be reversed? What needs managing?
If we're experiencing excessive hair shedding because of hormonal fluctuations, we can certainly arrest that and fix it, and the hair should come back. It's all about identifying the cause. So if we can rule out other things, if we just make sure we don't have nutritional deficiencies, there's not a medication that we've been taking routinely that actually is causing the hair loss. If we know what we're dealing with and we put it right, the hair should come back. That's in the sense of excessive hair shedding. When it comes to genetic hair loss or female hair thinning, it's really about arresting the hair loss, so stabilizing it. And in most cases, we would see improvement in hair growth. It's not going to completely reverse by any means, but I would ask all of my female clients in clinic at menopause experiencing hair loss and say, look, if you could just hang on to the hair that you've got now, would you be happy? And they say, oh, yes, that would be fine if I can just keep what I have. And that is
Yeah.
absolutely possible in most cases.
Well, that's what I like to hear.
Mm-hmm.
And you talked about hair cycles before. So how long does it realistically take to see improvements?
It depends what kind of treatment you're using. But let's say, for example, you are using topical Minoxidil as a treatment, which is the number one treatment for female hair thinning. Um, I would say within 8 to 12 weeks, you should be expecting to see some results. So you sometimes see where the hair follicles have given up growing a hair. If you're noticing that the parting's wider and the hair's a bit thinner to the top, in a lot of cases, you would see some very short, fine, wispy hair starting to grow through, and that can take about 8 to 12 weeks.
Okay. Well, so I love that this is promising and there are things that we can do about it.
Absolutely.
And this is what we want women to know. Lisa, are you up for a bit of quick fire?
Let's go for
Okay.
it.
Should we try some? All right. Best thing to eat for healthy hair?
First class proteins. If you're a meat eater, you're winning.
Yeah. One supplement that really matters.
Iron.
One myth about menopause hair loss.
It's completely reversible.
Love it. One thing to stop doing.
Over bleaching.
One thing to start doing.
Shampooing regularly.
More shampooing. Oh God, I only shampoo twice a week. I'm going to have to shampoo now. I have learned so much from this. I think my biggest takeaways is that, the hair changes are a signal.
Mm-hmm.
Your body is telling you something.
You're right.
Listen.
Mm-hmm.
But before you reach for a serum or reach for a peptide or reach for a hair roller or whatever it may be, ask yourself, am I eating well? Am I getting enough protein? How stressed am I? What's going on in my life? Like, just take a beat.
Absolutely. And let's not just jump on the next TikTok trend.
I think, and more importantly, there's things we can do about it. I love this idea that even just changing your shampoo to a more volumizing shampoo can
Yes.
help. But one of the biggest things that I've taken away from our conversation too is this idea of really understanding and diagnosing what kind of hair loss you are experiencing. So you don't waste a lot of money taking supplements that don't work or doing treatments that don't work. Take that 100 pounds or whatever, 200 pounds, get a consultation, get a blood test, and then you know what you're dealing with.
You really do. And I think what is also so important to that is when someone is with you on your hair loss journey, it's almost like you can stop worrying about it. Let the trichologist do the worrying. You can just follow the advice of your trichologist or your dermatologist. Use the treatment if that's what you have been recommended, and then you can let go of it. Be confident that the treatment is working. Your hair should be stable, and it's just something you can forget about.
Well, and I think no matter how, if you're a high-flying executive or if you're a stay-at-home mom, you've got so many things on your plate. I know for me, I always love feeling like I have a team, like that there's a person who's really rooting for me and really wants to see my hair improve or wants to see my health improve.
You're so right.
And it is an investment, but you're worth the investment.
I absolutely agree. Clients would come to me and say, Lisa, I've been saving up for a year to come and see you. That's how important their hair was to them. And even though it was a cost, they would look forward to their follow-up appointments with me because, for me to be able to say to them, your hair's really stable compared to the last time I saw you. We're taking photographs now. We took photographs before. I can show them evidence their hair has not changed in 12 months. They can breathe a sigh of relief and then get on with their life for the next 12 months.
Well, then the money you're spending is working.
Yes.
Like you're going in the right direction versus, like I said, spending money on supplements and taking them and not sure if it's working.
Agree.
And you're measuring the progress.
We're measuring. There's proof.
There's proof of it. Lisa, the final question we ask all of our guests, knowing what we know now about hair loss and menopause, what would you tell our 35-year-old listener?
Be careful with dieting. Your 30s are your time to build up your hair, build some resilience to your hair. So I would, and for me, for sure, during my 30s was, big dieting time. Just be careful with the diet.
What would you tell our 45-year-old listener?
don't ignore the early signs. You know your hair better than anyone else. If you feel your hair is changing, investigate early. That's really key to retaining the hair that you have in your 40s.
Oh, that's important, like, to hold on to the hair you have. Like you said to that one client, like, would you be happy with the hair you
Yeah.
have today if you could maintain that? Okay. And what would you tell our 55-year-old listener?
That it's actually about hair retention and maintenance in your 50s, in the menopause. So let's not get caught up with trying to reverse time and go back to being in our 30s. Let's treat our hair really well, treat our hair like cashmere, and let's do our best to maintain the hair that we have.
And I love this idea of that your scalp is an extension of the skin on your face.
It really is. So let's not neglect that part.
Lisa Bird, thank you so much for being part of our MenoPositive community. It has been wonderful speaking with you today.
It's been absolutely wonderful. Such a delight. Thank you.
And I don't know about you, but I am going to have to listen to this one again and take some notes. So if you have any more questions for Lisa, please leave a comment here or at menopositive.life on Instagram. And if you don't mind, don't forget to hit the follow button. I'll see you next time.
I got a good feeling.